I recall a conversation I had with my aunt after her surgery. She mentioned how the anesthesiologist was the one who made her pain go away and the one who made the procedure bearable. This was when I realized that I was truly enamored by the field of anesthesiology. It is such an interesting, complex field, and you might have had anesthesia at one point, such as during a dental procedure. I remember when I got my wisdom teeth pulled, they gave me laughing gas, and that made me feel no pain at all. So, let me tell you more about it. There's many things to be learned about anesthesia, but today I'll go over schooling, what anesthesiologists do, and types that they work with. So, how does one actually become an anesthesiologist? To put it simply, there's a lot of schooling involved. The first step would be to obtain a bachelor's degree. There's no specific major required to choose, but most students will choose a science major like biology or chemistry and declare pre-med in order to reach the pre-required classes for medical school. The AAMC lists some of these courses such as biology, chemistry, English, math or statistics, biochem, and others which does vary from school to school. After getting the bachelor's, a common misconception is that they go on to anesthesia school. That is actually not a thing, and instead they just go to medical school. They can either pursue a Doctor of Medicine or Doctor of Osteopathy program, but regardless, the first 2 years are traditional classroom learning, and during them, according to the AUC School of Medicine, they will either take the Step 1 exam of the USMLE if they're an MD, or Step 1 of Complex if they are a DO. The last 2 years will be clinical training, and this is where hands-on experience is gained and where they work with patients. After that, they match to a hospital, and this is where they will complete their residency. In their first year, they'll be interns, and after that, they are eligible to complete their licensing exams, and according to the AUC School of Medicine, they will officially be licensed and can practice medicine. In the second and third years, they'll be considered residents, and here is when they choose to specialize in their chosen field of anesthesiology. In the last year, they'll be considered senior residents, and this is when they finish up med school, and they're also preparing for the next steps, which will be to take and pass the American Board of Anesthesiology board exams. After all of that schooling, what is it that they actually do? Anesthesiologists perform many tasks on the job, and here are just a few. They will administer different types of anesthesia depending on what the patient and procedure needs, and they will also administer it consistently throughout a surgery. After administering, they will keep watch and monitor the patient to make sure that everything is going smoothly. According to the ASA, they will look over things like blood pressure, breathing patterns, oxygen level, heart rate, and level of consciousness. They will also let you know about the procedure beforehand and work closely with the patient to answer questions and develop an anesthesia plan. They'll supervise the patient after the surgery to make sure that they're recovering well, and according to the HSS, this may include administering an IV medication in order to help with post-operative pain. Having talked about schooling and what an anesthesiologist does, let's go over types of medication that they might administer. Depending on the procedure, different types will be used. The first type will be regional anesthesia, and this is what an epidural is. According to the ASA, the patient will be awake during it, and it numbs a large area of the body. So it's also used for surgeries involving the arm, leg, or abdomen, so a large area. Another type will be local anesthesia, and this numbs a smaller portion of the body. The patient will be awake, and it's used for stitching, deep cuts, working with a broken bone, or removing a mole. Another type will be monitored anesthesia or IV drip, and this makes someone feel very drowsy in order to make them feel calm, and it's used for minimally invasive procedures like colonoscopies. The anesthesia that actually puts you to sleep or makes you lose consciousness is called general anesthesia. This can be administered either through an anesthesia mask or an IV, and it's used for major operations like open heart surgery, knee replacement, or familiarly to many of us, wisdom teeth removal. To conclude, we went over how to become an anesthesiologist, what they do, and the types that they administer. The medical team during an operation is made up of many, and an anesthesiologist is just one part of that. Yet they still help the patient to a better future. Thank you for listening.